Hello, today we're going to be discussing a case study pertaining to HIV. Day 1. History of present problem. 25-year-old Hillary Valdez presents to the emergency department complaining of swollen lymph nodes, fever, fatigue, muscle aches, and chills. Current vital signs read temperature of 102.5 Fahrenheit, heart rate 110, blood pressure 130/76, respiration 17, and oxygen saturation 99% on room air. An 18-gauge IV is inserted into the left AC, and patient started on IV bolus of normal saline and given 500 milligrams as an oral tablet of acetaminophen to treat elevated temperature. Personal social history assessment. Ms. Valdez lives in Fayetteville, North Carolina in an apartment by herself with her dog, Bailey. She works as a cosmetologist and lives a fun and carefree life. She states that she's been seeing a man on and off for about 6 months now, whom she has unprotected vaginal intercourse with. She states that the relationship is not monogamous. Ms. Valdez also denies a history of STDs and states she has never been STD tested, in quotes, because she doesn't think it'll happen to her. She also denies a history of smoking and recreational drug use, but does drink alcohol socially. She is currently taking birth control pills called Loestrin. Question 1. What data from the patient's history is important, relevant, and has clinical significance for the nurse? Answer. It's significant that the patient has been engaging in unprotected vaginal intercourse with a man whom she is not monogamous with. It's also significant that the patient has never been STD tested before. These findings are significant because those combined with the patient's symptom complaints could be the result of a sexually transmitted disease or infection. Lab results. The provider in the emergency department requested a CBC, which is a complete blood count, and HIV testing. Results are as follows. The white blood cell count was 12,000, red blood cell count was 3.7, platelets 100,000, hemoglobin 10, hematocrit 35%, Western blot test was positive, ELISA was positive, and CD4 count is 350. Question 2. Which lab values are significant and why? The answer is all of the lab values are significant. HIV can cause high white blood cell count, low red blood cell count, low hemoglobin, low hematocrit, low platelet count, a positive Western blot test, positive ELISA test, and CD4 count can tell you what stage of HIV your patient is in. Diagnosis and meds. After receiving the patient's lab results, the provider diagnoses Ms. Valdez with stage 2 HIV and prescribes her new medication regimen. It's recommended that an initial antiretroviral regimen generally consists of 2 nucleoside reverse transcriptase inhibitors, also known as NRTIs, in combination with either a protease inhibitor, known as a PI, or a non-nucleoside reverse transcriptase inhibitor, known as NNRTI. Therefore, the patient is prescribed zidovudine, limivudine, and ritonavir. The provider also prescribes acetaminophen 500 mg tablets by mouth as needed for fever and mild pain, and morphine 2 mg IV push as needed for moderate severe pain. Because the patient is new to their diagnosis, the provider decides to admit them to the floor so that we can assist in getting their new medication regimen in place and monitor their CD4 count. Patient handoff. After receiving a report from the nurse in the emergency department, you introduce yourself to the patient. Following introduction, you begin to perform a physical assessment. Upon performing the physical assessment, you find that the patient's breathing is within normal limits. S1 and S2 are noted on auscultation. Lung sounds clear bilaterally. Skin is intact, warm, and dry. Swollen lymph nodes palpated on neck. IV noted in left AC, and the patient currently denies needs at this time. The current vital signs read 99.8 Fahrenheit for temperature, heart rate 99, blood pressure 125/80, respiration 17, and oxygen saturation 100% on room air. Question number 3. What is the nursing priority regarding the client's diagnosis? The nursing priority is to make sure the patient understands their diagnosis, educate them on what this new diagnosis of HIV means for them, educate them on the new medications being prescribed, and offer them emotional support if needed. This is important because HIV is transmissible and it's important for the patient to understand the disease and how it's spread. It's also important to adhere to your medication regimen to stop the disease from progressing to AIDS, putting them at greater risk for opportunistic infections. Depression is a common mental health condition faced by people living with HIV, making emotional support and reassurance detrimental to the patient's health. Day 2. Report. You receive Ms. Valdez as part of your patient assignment the following day. During a report from the night shift nurse, you're informed that the patient has been compliant with their new regimen of antiretroviral medication and pain has been kept under control with the patient, rating it a 2 out of 10 during hourly rounding. However, around 5 a.m. this morning, the patient started to experience a new onset of shortness of breath, productive cough, and chest pain when breathing or coughing. Question 1. What is the nurse's priority at this time? Physical assessment and vital signs. It's important to perform these skills to see if vital sign and assessment values are outside the normal range for the patient, which could signify a complication. Assessment. Upon assessing Ms. Valdez, it is found that she is coughing up a greenish yellow phlegm, experiencing shortness of breath, experiencing chest pain when coughing or breathing, rated at a 6 on a scale from 0 to 10. Crackles and wheezes are heard during lung auscultation. Dull chest percussion is noted. Capillary refill is greater than or equal to 3 seconds, and skin turgor is non-tenting. Vital signs read temperature 101 Fahrenheit, heart rate 115, blood pressure 130/82, respirations 25, and oxygen saturation 90% on room air. The patient is administered prescribed morphine 2 mg IV as needed for moderate to severe pain. After giving SBAR to the provider regarding the assessment findings and current vital signs, labs and diagnostic testing are ordered. The patient is started on oxygen 4 liters per minute via nasal cannula. Question 2. What lab and diagnostic tests can you anticipate that the provider will order based on the patient's current manifestations? Chest x-ray, sputum culture, CBC, and ABG. The manifestations the patient is experiencing are similar to those of pneumonia, which is a complication of HIV known as an opportunistic infection. These labs and diagnostic tests are ordered to either rule out or diagnose a pneumonia infection. Lab results. So it looks like the chest x-ray showed right upper lung consolidation. The sputum culture was abnormal, white blood cell count was 18,000, red blood cell count was 4.9, platelets 325,000, hemoglobin was 13, hematocrit 44%, pH 7.45, PaO2 was 68, PaCO2 was 36.2, HCO3 was 24, and oxygen saturation was 92%. Which lab values are significant pertaining to the patient's new chief of complaint and why? The lab values of significance would be chest x-ray, sputum culture, white blood cell count, partial pressure of oxygen, and oxygen saturation. Pneumonia infection will cause consolidation in the lungs. Abnormal sputum culture results signifying that there may be some kind of bacterial or fungal infection. Increased white blood cell count, a partial pressure of oxygen less than 80, and an oxygen saturation of less than 95 to 100%. Question 4. What would cause the white blood cell count to be higher than the normal expected range? Infection. Infection leads to inflammation and white blood cells are produced in response to this, causing an elevation in white blood cell count. Diagnosis. After interpreting the lab and test results, the provider has diagnosed the patient with pneumonia and prescribed the patient the following medications. Normal saline via IV, 150 milliliters per hour. Ciprofloxacin, 500 milligram tablets by mouth twice a day, every 12 hours. Maintain antiretroviral therapy, and maintain oxygen 4 liters per minute via nasal cannula. The nurse should also place the patient in high Fowler's position or encourage use of incentive spirometry and encourage deep breathing exercises. Question 5. What information is important for the patient to know pertaining to their diagnosis? It is important to complete medication regimen for treatment of pneumonia, maintain adequate amount of rest, maintain hand hygiene, avoid crowded areas, obtain immunizations for influenza and pneumonia, practice deep breathing exercises, and use the incentive spirometer as tolerated. This information is important as it will resolve the infection they currently have and reduce risk of future infection. Day 3. Report and assessment. You receive Ms. Valdez as part of your patient assignment of the following day. During report from the night shift nurse, you're informed that the patient has been compliant with their antiretroviral therapy for HIV, as well as their antibiotic therapy and oxygen administration for pneumonia. Upon assessment, patient reports that their shortness of breath, productive cough, and chest pain are still present but gradually improving. The patient rates their pain a 2 on a scale from 0 to 10. Auscultated crackles and wheezing are improving. Chest percussion is no longer dull. Breathing is within normal limits. Capillary refill is greater than or equal to 3 seconds. And skin trigger is non-tenting. Current vital signs read temperature as 99.4 Fahrenheit, heart rate 102, blood pressure 128/86, respirations 19, and oxygen saturation 99% on oxygen given 4 liters per minute via nasal cannula. Question 1. Which assessment findings are significant? The patient's breathing, lung sounds, cough, chest pain, oxygen saturation level, pain level, heart rate, blood pressure, temperature, and respirations are all improving. The improving vital signs and assessment findings and the fact that the patient has been compliant with her medication regimen signify that the patient's condition is likely improving, although it has not completely resolved. Lab results. Current lab results read as following. White blood cell count 11,000, red blood cell count 4.9, platelets 325,000, hemoglobin 13, hematocrit 44, pH 7.45, PaO2 is 79, PaCO2 is 36.2, HCO3 24, and CD4 count is 450. What lab values are significant and why? The lab values of significance would include the white blood cell count, partial pressure of oxygen, and CD4 count. The fact that these are improving means that the patient is adhering to her medication regimen, her pneumonia infection is resolving, and her antiretroviral therapy is reaching a therapeutic level. The patient will continue her antiretroviral therapy of zidovudine, limivudine, and ritonavir. The patient no longer has a fever, but an as-needed prescription of acetaminophen 500 milligrams oral tablets is being kept. The patient will continue taking ciprofloxacin 500 milligram tablets by mouth twice daily, every 12 hours, and oxygen therapy has been discontinued. Question 3. How do people get opportunistic acquired pneumonia? People with a suppressed immune system, such as people with HIV or autoimmune disorder, can contract pneumonia. People acquire these infections easily because of their lack of immunity. Day 4. Report and assessment. You receive Ms. Valdez as part of your patient assignment the following day. During report from the night shift nurse, you're informed that the patient states she is feeling much better. Urine output is 30 milliliters per hour. Patient had a bowel movement last night. Patient cough is productive but improving. Patient is no longer experiencing shortness of breath, and chest pain has improved. Upon assessment, the patient informs you that shortness of breath and chest pain are still improving, but the cough is lingering. You find that crackles and wheezing on lung auscultation have resolved. Breathing is within normal limits. Chest percussion is within normal limits. Patient rates pain 0 on scale from 0 to 10. Capillary refill is greater than or equal to 2 seconds, and skin trigger is non-tinting. Current vital signs read as following. Temperature is 98.6 Fahrenheit. Heart rate is 88. Blood pressure is 118/80. Respirations are 16. And oxygen is 100% on room air. Question 1. What data from the patient's assessment is important, relevant, and has clinical significance for the nurse? The patient's breathing and oxygen saturation have improved. Patient's crackles and wheezing have resolved, and patient is currently in no pain. Urine output is 30 milliliters per hour, and cough is productive, and the patient is no longer experiencing shortness of breath. All of these assessment findings signify that the patient's infection is resolving, and the patient is adequately hydrated and productively expectorating. Current lab values are as follows. White blood cell count is 10,000, red blood cell count is 4.9, platelets are 325,000, hemoglobin 13, hematocrit 44%, pH 7.45, PaO2 is 90, PaCO2 is 36.2, HCO3 is 24, and CD4 count is 465. Question 2. Which lab values are significant in relation to the patient's current health problems and why? The lab values of significance would include white blood cell count, partial pressure of oxygen, and CD4 count. The patient's white blood cell count or partial pressure of oxygen. The patient's white blood cell count and partial pressure of oxygen are within normal limits, meaning the pneumonia infection is resolving. The patient's CD4 count is improving, signifying that her antiretroviral therapy is working, which works to keep the CD4 count high so that the patient remains healthy and does not continue progressing in their disease of HIV. Question 3. The provider is discharging the patient home. List 3 important topics the patient should be educated on before leaving the hospital. Medication adherence, proper diet, and lifestyle modifications. These topics are important because medication adherence and proper diet will resolve their pneumonia infection and improve CD4 count pertaining to HIV. Lifestyle modifications will decrease their risk of contracting other opportunistic infections and lessen the risk of transmitting HIV to others. Discharge. The patient is discharged home with information regarding medications prescribed, adverse effects to monitor for, signs and symptoms of infection to monitor for, community resources regarding HIV diagnosis, dietary recommendations, lifestyle modification recommendations, follow-up appointment with their primary care physician, and other important information relating to their diagnosis. Medications prescribed for home administration include zidovudine by mouth, lamivudine by mouth, ritonavir by mouth, and ciprofloxacin 500 mg tablets by mouth, given twice daily every 12 hours, taken for a total of 10 days. All right, and that is the end of this case study. Thank you and have a great day.